Hello, you're listening to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us today. There are a lot of places that you could be, and you chose to spend some time with us, and for that, I'm grateful. It's estimated that 1 in 42 boys is born with autism. 1 in 68 births overall will be an autistic birth. Our guest in studio today is returning to talk with us about autism and how we as a community can help the autistic community. He's an autism dad and a media and technology company executive as well, and he's applying his vast professional experience to this very personal issue of autism, being an autism dad. How are you doing today, Topher?
I'm great, thanks.
Thank you so much for returning. As the founder of Autism Village and the developer of a new app that's soon to be released that deals with autism, could you tell us a little bit about why you're interested in autism, other than the fact that you are an autism dad, and how you got into developing this Autism Village and this app?
Sure. Well, essentially, when our son was diagnosed with autism about 11 years ago, we started the process that 3 million other families in the United States are on, which was to work out how to best support and raise our son with autism. And through that process, one of the things that we noticed was there's lots of people working on research, causes, cures, the sort of medical side. Lots of interesting things happening there, and certainly on the therapy and educational side, lots of interesting things happening there. People using software-assistive technology. Certainly, the iPad has been a revolutionary device for autistic kids. But what we noticed is that the practical day-to-day problems that families have were not being as well addressed. And so I'd say that our project is the result really of the last 10 years of experience, just looking at what exactly are the practical day-to-day issues and challenges that you have when you're raising a kid with autism. And since we've really been out and about, we've heard from a lot of autistic adults who share a different set of practical day-to-day problems navigating in sort of the world that the rest of us live in.
Mm-hmm. Now, when it comes to developing apps, it's not like they're developed for free unless you're, sitting around in a dark basement somewhere just geeking away at it. Could you tell us a little bit about how you got more than 10,000 Facebook followers and Twitter account holders to get on board with you and support you in your development of this app and in support of Autism Village?
Well, we started to talk about what we wanted to do on the social media pages, and the response was, as you described, it's surprising. We knew that it was an acute problem, but I think we were surprised at how quickly we accumulated followers and accumulated input. There's a number of these practical problems that we've been out to solve, everything from coordinating teams that are tricky to coordinate because professionals come from different organizations, and sort of the HIPAA paperwork and privacy laws work against you when you're trying to coordinate a team of people from multiple agencies, to the day-to-day communications and classroom management for teachers, to tracking things like drug efficacy and seizures and so forth, and then right through to the most practical problem, which is just if I'm dad on duty on a Saturday morning with a young autistic boy, how do I find a playground that's fenced on all sides with only one entrance and egress sort of a thing, or how do I find a barber who will work with my autistic kid or whatever. So that's really how the app came to be, and as soon as we started talking about it, the followers mounted quickly. I think we were at 10,000 followers on Facebook in less than a month.
You did mention that, you have a team of people. You're not in this just you and Kirby and your wife and your other son. You have a team of professionals that are that have different specialties and skills that move this village forward. Could you talk a little bit about what types of people that you have on your team?
Sure. Well, I'm blessed from a fairly rich career in media and marketing and technology to have a great professional network. And when I said that I was going to work on this, we had all kinds of people volunteer to help in different areas. And so We really have we have technologists, we have marketing, we have public relations, we have pharma specialists, we have educational specialists, and with 1.5% of births being autistic, with 1 in 68 being autistic, you don't have to go very far for folks to have a grandson or a granddaughter or a son or a daughter or a niece or a nephew or somebody close to them that maybe is working with this challenge. So a lot of folks came out of my professional network and volunteered their time to help us get this app together from all those different disciplines.
Now, have you had any feedback from healthcare professionals themselves as to how helpful your app is, and not necessarily from a medical standpoint, but just the standpoint of making things more accessible for those suffering from autism?
Oh, we sure have. We've had great early feedback, for example, on the team collaboration spaces and the document management system that we have in beta from healthcare specialists in autism. But historically, sort of this is all paper-based, and parents have file boxes and file boxes of paper, and it's very difficult for a psychiatrist, for example, to collaborate with a teacher. But one of the features that we have in beta provides private and secure collaboration spaces where discussion threads or discussions around videos, behaviors, or the development of treatment plans or education plans can be done as a group, and documents can be shared so that a new doctor on the case can really review the entire file instead of that paperwork gathering mold in the basement. So we've had very, very positive feedback from the healthcare professionals about it.
So not only providing greater access to the autistic community, it also streamlines keeping track of resources, keeping track of day-to-day things that you might discover as your autistic child or the autistic adult progresses, yeah?
Sure does. For example, in the when you're working with a drug, pharmacological intervention or otherwise, many of the drugs are being prescribed for off-label use for autism, and as a result, the understanding the drug efficacy and so forth, or combinations of drugs and what their efficacy is a real trick. And with the drug tracking app that we have under development, a teacher or somebody in a school setting can take a video of a new behavior or something's changed and comment on it, and a psychiatrist can be alerted right away to view that. Similarly, neurologists that are working with kids that have autism, may have seizures, can actually see a seizure with all the information automatically captured, duration, location, all that stuff. So it definitely has streamlined, certainly streamlined the situation, and to the extent that you can accelerate the team working with these kids to come up with what the next step is in the strategy, you're making better use of the short time that you have while the kid is really between diagnosis and sort of the mid-20s, when they kind of start to become who they're always going to be.
Now, as we wrap up this segment, I'd like to ask you about your future plans as far as app development, this being the first app. Is your team working on different apps or continuing to work to improve this one as the years go by?
We're the center of all of this is a private and secure social hub, which combines features of Facebook and Microsoft SharePoint and other more public social tool sets. And then the apps are really meant to be specific interfaces to that core specialized social hub to solve different use cases. So the Yelp app that we'll be launching this, Yelp-like app that we'll be launching this summer, the other team coordination apps for the logging and charting apps that I described are all pieces of a puzzle that go around this social engine for the autism community.
Tell our listeners exactly where they can get more information about Autism Village, autism in general, from your perspective, and more information about the soon-to-be-released app.
Well, certainly, you come to our website to keep track of what we're doing, and with the release of our app, it's autismvillage.com. Our social media sites on Facebook and Twitter, and our weekly newsletter, which you can sign up for on our webpage, have more general information about autism, and we'll link you to other autism-related resources.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neil Howard. We've been in studio today talking with returning guest Topher Wurtz, an autism dad and a media and technology executive who's started, along with his son Kirby, Autism Village. And Autism Village and their team of strong supporters have developed this new app that is designed to make businesses and resources more accessible in a more timely manner to those who are suffering from autism. It's been great having you here with us today, Topher.
Thank you so much for having me.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.